Hi, I'm Dr. Tracy Marks. I'm a psychiatrist and psychotherapist, and I'm here to give you a tip about why and how to use a light box. This is designed to be for information purposes and not intended to be medical advice or treatment. So what is light therapy? Well, bright light therapy is where we use light that is the same intensity, color, and wavelength of sunlight. Bright light therapy traditionally was used for seasonal affective disorder, when someone, because of not getting very much sunlight exposure, may get depressed in the wintertime, and then when there's increased light exposure, may even get manic or hypomanic in the springtime. Well, more recently, we have realized that light therapy is even beneficial for more than just seasonal affective disorder, but even for depression. It's considered an adjunct treatment for depression. So if you are someone who is on antidepressant medications and let's say you're 80% better and just feel like you need to be a little bit better but don't want to change your medication or try anything different or even add another medication, you could consider using light therapy as an adjunct to help boost the effectiveness of your medication. But in addition to that, light therapy is also very, very helpful in regulating sleep. It can help you be someone who becomes more of a morning person and just pops out of bed in the morning. Suppose you've spent the whole summer going to bed at 11 o'clock and waking up at 7 or 8 o'clock, and now you really need to be up at 6 or even 5 o'clock in the morning. And how in the world are you going to accomplish that without a lot of pain and suffering? Well, light therapy can help pull your sleep forward. So what is light therapy? Here's an example of a light box. It's very small. They used to be these huge contraptions that you have to sit on a shelf. Now, and there's some that's even smaller than this. This is probably 4 or 5 years old, this particular device. You turn it on. It's very bright. And it's pretty bright, but it's not that bright, actually. But the way you would use it is you would turn it on, and you would use it for 15 to 30 or even perhaps 45-minute intervals or increments, and that would be a session. You would hold it at least an arm's distance, not sure if you can see this, arm's distance at like a 45-degree angle to your eyes, so that your eyes actually see the light, but you're not looking directly at it, kind of like you wouldn't look directly at the sun. So if you're trying to, say, get ready in the morning, and also you would use it first thing in the mornings upon rising. So let's say within an hour of waking up. Because if you use light, this type of light, too late in the day, it can actually push back your sleep to where you have trouble going to sleep in the early evenings. So you could use it first thing in the morning. You could put it, say, on a shelf in the bathroom while you're getting dressed. If you need to, say, go to your closet to get something, just grab it and walk with it, and it can follow you. So you don't have to have 15 minutes where you're just sitting doing nothing. You can continue to be active while you're using the light therapy. You could start with 15 minutes. 30 minutes would be an average time, probably more effective if you're trying to use it for depression. 15 minutes could be suitable for someone who's just trying to wake up earlier in the morning. If you start using this to help you wake up in the morning, you should probably see results as far as waking up on your own at that time within a day or two. It works very fast that way. So, little tip for the day, light boxes, light therapy. I can put a link in for a couple of types. This happens to be a Philips Go Light, but there's many out there on the market. So good luck to you, and thanks for listening.